Very good evening, friends. Meeting again with the new session of Materia Medica. Yesterday we have finished one nosode, that is syphilinum. And today we are going to learn one more remedy which is not so commonly known to everyone but used to have very important role in certain specific conditions of the nervous system. They are very important in migrainal attacks. This remedy is prepared from the tobacco, and that is tabacum. This remedy was proved by many provers. Earlier, it was proved by Dr. Lemte. Then this remedy was proved by Dr. Scherter. Then Dr. Douglas from USA, who has also proved this remedy. So many provers are there in the proving of tabacum, and many features of tabacum, they are related with the nervous system, they are related with the brain, they are related with the GI tract, and which gives you a very common prescription if you understand the core of the remedy. If you understand the clinical aspect, then you will understand the depth of the remedy. We generally overlook the tabacum, but if we understand where exactly this place or this comes, then definitely this will help you in your practice. I will share a case, interesting case. A young fellow around 32 years of age came to me, and he had a very severe migrainal headache since 4 5 years. And what used to happen to him, used to get a suddenly darkness, dim vision, then he suddenly starts getting the vertigo. And when he starts getting vertigo, it was very difficult for him to handle. He goes immediately, he understands that now headache will going to come. He gets disturbed because of that, and the headache starts. The headache was of a severe neuralgic character, and he was not able to move the head. Every time it is associated with tremendous nausea, tremendous vomiting, and he used to get into a palpitation. Many times he had fallen down because of hypovolemic shock, and this used to happen every time. The patient was treated by many neurologists. They have taken the X-rays, they have taken the CT, the brain MRI, everything was done. Even nerve EMG and nerve conduction studies also have studied for him, and nothing worked out. Diagnosis was simple: migraine. That was the only diagnosis done, and they said whatever possible is given to you, and that's all. That you have to continue. He had habit of taking migraine tablet. He had habit of taking along with that rabeprazole, domperidone. Then he had habit of taking the tranquilizers before sleep. But nothing was perfectly working, and he had every month nearly about he had attack of this. But whenever he had the attack, he had a sudden panic state, and he goes into sweating stage, the palpitation, then the disturbance, the restlessness. And this vertigo was very, very important in his case. The vertigo was associated with many times going into unconscious state, shock state, and patient used to feel better whenever he is going outside the house in open air. That is the only thing with which he used to get a better feeling. Otherwise, the vertigo and headache was continued. He was not able to tolerate the slightest noise, light also aggravating his headache. And he used to find only relief whenever there is an open air. He asked to open the windows, he asked to open the doors, everything. And that is the only thing with which he used to feel better. The nausea was incessant during this attack. And that's why I consider this is very typical feature which are indicating the tabacum. So I have started him on Tabacum 30. Tabacum is the remedy which you don't have to go for higher potency directly. because tabacum itself in crude state affects the human mind, human sensory. So you don't have to go. The proving have been done, conducted in low potencies only 30, 200. So even in 30, it works so beautifully. So I have started him on Tabacum 30. You can repeat in for 3, 4 days, and then you can stop. Once the action is developed, then you can stop. I have given Tabacum 30 to him, and he was there, came during the attack of headache, and I have started him on Tabacum 30 and asked to meet me after 15 days. After starting Tabacum, next day his headache was totally relieved. No more nausea, no more vomiting, and he was happy when he returned after 15 days. He said that next day I was feeling better, and thereafter till today I have not had an attack. So I have kept him on placebo. Asked him to reply if he had attack, otherwise do come after 15 days. Again, I have given him placebo for 15 more days and asked him to come after 15 days. After 15 days, when he returned, he never had an attack and he was better. So I have considered it's better to wait instead of going for higher potency and kept him on placebo. For 2 months, he was on placebo without any attack. And after 2 months, one day he had a severe attack of headache again. This time he returned in between, asked me, give me that medicine which you have given me on the first day. Here, the severity was not that severe as earlier, but he was in agony. So I decided to give him Tabacum 200, one dose only. I have not repeated. In higher potency, you should not go for repetition in such types of things. One dose, and I have continued him on same placebo. Next day, he reported me, yes, after 2, 3 hours, I felt better, and gradually headache also stopped. I felt better, the palpitation stopped. I never had vomiting this time, but I had nauseated feeling throughout the day, but it disappeared today morning when I wake up. So this is the one remedy which you must think always. If the migraine is associated with severe nausea and vertigo, very severe nausea and vertigo with migraine, with craving for open air, with hypotension, this is one remedy. And second case in which I have used was a case of yesterday I have discussed that Hirschsprung disease or Hirschsprung disease. This is also a remedy for paralytic abdomen, paralytic state of abdomen. Here, it also has chronic, for years together, the constipation is there, and it is because of the paralytic ileus. So, I have used once Tabacum with successful result in Hirschsprung disease. So, let us learn what Allen says about this remedy. It is tobacco, not Indian tobacco. Tabacum tobacco solanaceae family. Diseases originating in cerebral irritation followed by marked irritation of the functions of vagi. Vagal nerve stimulation, the features which develops, they are very typically expressed over there. And that's why vertigo is one important hit of it. Second important is the nausea which caused because of the irritation of vagus nerve. And third important thing is that the vomiting associated with that and headache. Emaciation of the cheeks and back. So cheeks becomes emaciated, the back becomes emaciated. Complete prostration of entire muscular system. So it has very typical action on the nervous system, the muscular system. Sensation of excessive wretchedness. Wretchedness is, you can say, white pana or dukha. That is excessive sensation of excessive sadness, which happens to be there, which develops over there in such personality. Icy coldness of the surface covered with cold sweat. And this is the shock state. Whenever patient has panic attack of headache, vertigo, every time it is followed by sweating and there is coldness of sweat. Symptoms occurs in paroxysms, the asthma, the sick headache, the vertigo, and sneezing. All those symptoms appears in paroxysms. There is one paroxysm, again patient feels better, again second paroxysm. So paroxysmal headache, paroxysmal vertigo, paroxysmal sneezing. This is a very important remedy. Great despondency. Patient becomes despondent, nirash, with indigestion, palpitation, and intermittent pulse. So again, having action on heart, where the intermittent pulse, the palpitation, these are quite common features which appears over there. Vertigo, death-like pallor. Whenever shock happens, patient goes into pallor state and patient goes into absolute sudden shock, increasing to loss of consciousness, relieved in open air and by vomiting. Vertigo on rising, vertigo on looking backwards. Most important characteristic is vertigo on opening the eyes. Whenever patient opens the eyes, he feels fear to open the eyes. That is very characteristic of the Tabacum vertigo. They fears to open the eyes. This is very, very important. Sick headache coming on every morning, early morning. Intolerable by noon. Deathly nausea. Violent vomiting. Aggravated by noise, aggravated by light. Sick headache periodical lasting for 1 or 2 days. Very typical migraine variety which you can get over there. So it is periodical, it happens for 1 to 2 days, persistent. Sudden pain on right side of the head as if struck by hammer or club. Club म्हणजे it is a stick, kathi, danduka. Dim sighted, sees as through a well. Well म्हणजे burkha. Strabismus, squint, depending upon the brain troubles. So dimness of vision is related with the brain troubles because of strabismus. Amyloidosis, loss of vision from atrophy of retina or optic nerve, pathological general, you can think about this. So brain troubles, not only in brain, but it is nervous system which gets affected over there. Face is pale, blue, pinched, sunken, collapsed, covered with cold sweat. Cold sweat specifically on forehead, it is veratrum album. Vomiting. Vomiting is violent character with cold sweat. Vomiting as soon as he begins to move. Slightest movement aggravates the vomiting. Vomiting during pregnancy when lactic acid fails. Very important feature which has been mentioned. Lactic acid is one of the important remedy for the morning sickness. Lactic acid is also very good remedy for diabetes mellitus. So same feature which is there in Sorina also, morning sickness. Seasickness, deathly nausea, pallor, coldness, aggravated by least motion, and ameliorated on deck on in fresh old air. So seasickness, whenever they are on ship, if they get vertigo, headache, vomiting, nausea, and they want to go on open air on deck, and they feels better in that. This is a very important remedy. Terrible, faint, sinking feeling at the pit of stomach. So that feeling is associated with this nausea. Sense of relaxation of stomach with nausea, like ipecac and staphysagrine. Child wants abdomen uncovered, given in italics. And this is very typical. This you can see when you are in practice, you observe there are certain children who keep their abdomen open. Relieves nausea and vomiting, coldness in abdomen. That is another feature which you can get in over there, like colchicum, like elaps, like lechesis. Constipation, inactive bowel, or paralysis of the rectum. This is what I want to highlight over there. Yesterday, we have learned it in Cipilinum. Spasms of sphincter, prolapsus ani, of constipation of ear standing, constipation with herpes of anus. So this is very good, important remedy in chronic constipation, paralytic ileus, hirschsprungosis. Diarrhea, sudden, yellowish, greenish, slimy, urgent, watery, with nausea, vomiting, prostration, and cold sweat like Veratra. With diarrhea with extreme faintness from excessive smoking. So diarrhea from excessive smoking, diarrhea from extreme faintness. This is one thing one should not forget. Renal colic, violent spasmodic pains along the ureter, left side like Barbaris vulgaris. So this is good remedy in left ureteric colic. Deathly nausea and cold perspiration associated with severe nausea and cold perspiration. Palpitation violent when lying on left side. So whenever he lies on left side, the palpitation aggravates like lachesis and goes off when turning to the right. Pulse is quick, pulse is full, large, small, intermittent, exceedingly slow sometimes. Pulse is feeble, irregular, almost imperceptible. So there are both stages. Either pulse is very high, either pulse is very slow. Hands icy cold and body is warm. Legs icy cold from knees down, trembling of the limbs. The relationship one must, I will suggest that one must go through it and make a slide of it and keep it in on your desktop. Because here he has mentioned how to utilize the abuse of tobacco in different condition and what remedy one should think of. Very nicely explained by Alan over here that, see, ipecac for excessive nausea and vomiting. Excessive nausea and vomiting because of tobacco, ipecac. Arsenic for bad effects of tobacco chewing. If there are bad effects of tobacco chewing, then you must think of arsenic album. Naxomica for gastric symptoms next morning after the smoking. So GI troubles which develops after the tobacco smoking, Naxomica. Phosphorus for palpitation, tobacco hurt, sexual weakness. Ignatia for annoying hiccup from tobacco chewing. Clematis or plantago for tobacco toothache. See, very important hints. Clematis or plantago for tobacco toothache. Sepia for neuralgic affections of right side of face. Dyspepsia, chronic nervousness, especially in sedentary occupations. Lycopodium for impotence, spasms, cold sweats from excessive smoking. Gelsemium, occipital headache and vertigo from excessive use, especially the smoking. Tabacum, potentiated or potentized 200 or 1000 to relieve the terrible craving for when discontinuing use. So if there is a terrible craving and which is not getting settled, give the Tabacum 200 or 1 m few doses, and that is very helpful for the patient to relieve that craving. General modality opium, general modality amelioration, open air, fresh air, cold air, uncovering, patient feels better. In remedy relationship of Gibson Miller, the complementary is not mentioned, but Dr. Nambison in his book of drug relationship, which he has written along with Nair's work, here he has mentioned complementary as opium into this tobacco. The potency generally, it has been mentioned 3rd to 30th potency, repetition in low potency, but in high you should not. So repetition depends upon situation. SOS basis you can repeat this remedy. So this is a wonderful remedy. One can use in such types of disorders where migraine associated with palpitation, associated with shock, sweating, vertigo. Then Hirschsprung disease, that is another condition in which you can use associated with the severe nausea and vomiting. Think about this remedy. So a remedy with neuromuscular action, GI tract action, and useful in day-to-day practice is Tabacum. Try to use it and see the results of Tabacum. Even in left ureteric colic, you can think about the Tabacum. So that's all for today. We have finished one more from third year syllabus. In fact, we are on concluding part of the syllabus from the third year. So we'll meet tomorrow again with another remedy. Thank you very much.
हॅलो हॅलो सर.
Yes.
Thank you very much, sir.
सर एक विचारायचं होतं. हॅलो
Yes, yes.
सर, एक पेशंट आहे म्हणजे त्याला टोबॅकोची खूप क्रेविंग आहे, म्हणजे ऍडिक्शनच आहे ते, पण ते म्हणजे घेतल्याशिवाय काही सहन होत नाही. ते आजकाल येतं ना पान मसाला, रजनीगंधा, त्याच्यामध्ये टोबॅको.
If you talk loudly.
हॅलो सर, एक पेशंट आहे त्याला टोबॅकोची, आता आवाज येते सर?
Yes, yes.
हॅलो. त्याला टोबॅकोची खूप क्रेविंग आहे, म्हणजे ते आजकाल येते ना ते पान मसाल्यामध्ये टोबॅको, तर ते पण त्याला कमी करायसाठी जी त्याची इच्छा आहे, पण ते क्रेविंग ते सुटत नाहीये, तर त्याच्यासाठी पण टॅबॅकम देता येईल का?
Yes, yes,
कॉन्स्टिट्युशनल सुरू
definitely.
आहे त्या पेशंटला,
Yes.
तर मग थोडं
Tabacum
कॉन्स्टिट्युशनल
followed by
स्टॉप करून.
Naxomica.
हा, ऍक्च्युली ना नसकोमिकच त्यांची कॉन्स्टिट्युशनल आहे,
Tabacum
त्याच्यामुळे ते ब्रेक करून. हा
intercurrent you
हा.
must use.
अच्छा, ते स्टॉप करून मग टॅबॅकम किती दिवसासाठी द्यायचं सर? 2-3
Tabacum
दिवस का?
फक्त few doses, 3 doses, 6 doses, that's all, not repetition.
अच्छा, 3 डोसेस म्हणजे एकच 15-15 मिनिटं आणि 3
Yes, yes,
डोसेस
yes,
बस.
yes.
अच्छा अच्छा, आणि मग नेक्स्ट डे पासून कॉन्स्टिट्युशन सुरू करता येईल?
Naxomica you can give. Naxomica is the
अच्छा.
acute remedy.
हा 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 सर, हा.
Okay.
थँक्यू सर. अजून एक विचारायचं सर. हॅलो
Hmm.
हॅलो. हा सर,
Uh,
एक पेशंट आहे, मी तुम्हाला मेसेज पण टाकलाय, तर ते त्यांचं स्पायनल ऑपरेट झालं, म्हणजे लॅमिनेक्टॉमी केली आहे त्यांनी. L3-L4 मध्ये जे डिस्क असते ते ऍक्च्युली ती रिमूव्ह केली त्यांनी. तर त्यांना असं होतं की भयंकर त्रास होत आहे, तर ते बिलकुल वाकू शकत नाही, म्हणजे ते तर पूर्ण वाकण्याचं टोटली बंदच झालं आहे. ते लेफ्ट सायटिका आहे त्यांना, तोही त्रास खूप होत आहे, तर डॉक्टरनी त्यांना ओझोन थेरपी सांगितली आहे. तर ते ओझोन थेरपीचे काय, म्हणजे कसं काय असतं त्यांचे बेनिफिट वगैरे, किंवा काही काही माहिती आहे का सर?
no, I don't know regarding the ozone therapy. So I cannot
त्यांनी मला
comment on
विचारलं,
it.
मी म्हटलं मला माहित.
No,
अच्छा अच्छा.
I
ते
don't know
ऍक्च्युली
regarding
सिरिंज
ozone therapy.
मधनं. अच्छा, सिरिंज मध्ये घेऊन ते म्हणाले की म्हणजे इन्सर्ट करतात की ते नर्व जे आत ते दबलेली आहे ती बाहेर येईल. मग सर, अशा ऑपरेट झालेल्या केसेस मध्ये आपण कुठपर्यंत विचार करू शकतो ट्रीटमेंटचा?
You can give the
क्रॉनिक जर
medicine
दिली तर?
definitely. Taking into
अच्छा
consideration the whole case, you can prescribe.
अच्छा अच्छा अच्छा.
You can give the
ठीक आहे
very
सर.
good results in such types of cases.
अच्छा अच्छा, ओके सर, ओके सर. सर, मी सुरू करते, जर त्यांची इच्छा असेल तर मग तुमच्याकडे रेकमेंड केलं तर चालेल?
Okay, okay, no problem.
चालेल. ओके ओके सर.
Okay,
थँक्यू सर.
okay. Thank you and good night.
Thank you, sir. Good night.